Good news! The condition of my hip implant after 5 years is perfect, and the surgeon complimented my care for his work. The x-rays show that the plastic liner of my right leg's titanium hip implant assembly is in excellent shape. Also, the ball joint of the other leg is still in good condition and does not need replacement anytime soon. So what have I been doing or not doing for 5 years to achieve this outcome? First, I do lots of fast walking but do not run, and I spend a lot of time on my feet. Second, I kneel to avoid squatting and, when possible, use my arms to help me back to standing. Getting down and up from the floor requires some thought, and it is an action learned in surgery recovery. But remembering to move correctly can be challenging when pain is no longer a deterrent. Also, I avoid hip joint compression by not jumping or letting myself fall. Finally, I do not lift or pull heavy objects in a manner that requires straining or pressuring my hip joints. Instead, I get help or use something around me as a simple machine, such as an inclined plane, wheel, or a pulley for leverage. Luckily, my lifestyle before surgery was similar, so I did not need to adjust much. However, I no longer drink alcohol. Knowledge of wine, beer, and booze has been critical to my restaurant career, but it is only one aspect. The reading and talking to beverage tasting peers is sufficient to keep me sharp. My occupation is a big ticket item to change. Hotels and restaurants vary, but most are not appropriate workplaces or work cultures for me as I age. I aim to exit the hospitality industry, and my focus is developing skills to grow my You Do For You business. Suppose you are in a similar predicament. Other occupations have identical hazards to consider when planning a future with a hip replacement. In addition, different kinds of surgery, such as knee or back, may require the same thought process. Whatever the long game is, do not let it deter you from getting the necessary procedure. Delaying things may complicate recovery and add more challenges after. Refrain from grinding at what you are doing until your body stops you. Instead, plan your future as best you can. In the meantime, I recommend learning about your physical needs and asking for help. Friends, family, and workmates can be excellent advocates for your healing process or workplace adjustment. Also, talk to others who have the same condition. A training program or some classes can be financially more advantageous in the long run. The internet has a wealth of knowledge too, but seek the correct professional medical care in any case. For example, acupuncture or chiropractic treatment offers short-term relief, but cannot replace the need for surgery. My next hip replacement check-in is in 3 years unless I have issues. Until then, I plan to exercise a smidgen harder, but will ask my medical team before trying anything questionable. The average lifespan of a hip replacement is 15 years. If I behave responsibly, mine may last longer. I do not plan to make a habit of having surgery to repair damage caused by poor judgment. The recovery time disrupts my ability to move at will and enjoy life. I want to hike, kayak, and be mobile for as long as possible. Help me exit the hospitality industry by supporting You Do For You. Watch my YouTube playlist, Hip Adaptive Equipment, You Do For You vlog, and Tales by Martin E. Dodge. Use the like, subscribe, and notification bell icons below the videos. Buy You Do For You design shirts, hoodies, and novelties at youdoforyou.com, and buy my books at amazon.com, especially the one about hip replacement adaptive equipment.